This presentation discusses the paper on chronic tonsillitis and biofilms and looks at some of the new treatment modalities. It was written by a team from the National Defence University of Malaysia, Swansea University, the University of Dundee and the University of the West Indies. I'm Judy McKim from Swansea University, speaking on behalf of the team. So, the importance of discussing biofilms and treatment in tonsillitis is because it is a really important global health issue. So recurrent tonsillitis can be described as when an individual suffers from several attacks of tonsillitis per year, around 5 maybe. These recurrent infections are caused by microorganisms, and often these create biofilms and a repository infection in the folds of the tonsils. And because the tonsils are folded and act as a repository, this can then lead to chronic tonsillitis. So in this review we look at different treatment modalities, some of the advantages and disadvantages, and some new treatment options which look at the biofilms themselves. So, chronic and recurrent tonsillitis is a serious global health problem. It affects an awful lot of people, not just children, but adults as well. And it has large economic consequences, cost to the healthcare of providing antibiotics or surgery, but also the cost to the individuals themselves. It is more prevalent in children, leading to time off school and education, and of course a significant impact on the quality of life. So antibiotics have been used for many decades really, and they can provide temporary relief, but the tonsillitis often recurs, and this is primarily due to the biofilms and the antibiotics or the antimicrobials not getting to the biofilm itself. Of course, in the past, surgery has been a treatment. It's still used, but less so than it used to be, but it does result in many complications. So biofilms themselves have been observed for hundreds of years actually, since the 17th century, when Van Leeuwenhoek observed them. And biofilms are present in between 65 to 80% of human bacterial infections, depending on which studies you look at. Biofilms are systematised communities of microorganisms, and they're embedded in a hydrated matrix of extracellular polymeric substances. And to know this is important when we have to think about the treatments for addressing the biofilms. But they don't just cause tonsillitis, they cause diverse persistent infections, dental plaque, cystic fibrosis, urinary tract infections, ear infections, otitis media, osteomyelitis, just to name a few. In tonsillitis itself, Carnier et al. Said that they looked at, in their study, at biofilms being reported in 70% of chronic tonsillitis patients. So biofilms, are widespread. Thomas et al. Put it in a nutshell really in this quote. They pose a serious problem for public health because of the increased resistance of biofilm-associated organisms to antimicrobial agents and the potential for these organisms to cause infection also in patients with indwelling medical devices. So the resistance is important, not just in biofilms, but to many bacteria. But actually, the other side of things, looking at how these infections can be caused with indwelling medical devices, can lead to really serious infections like bone infections or perhaps devices in the heart or other areas of the body. So how do they form? Well, there are 5 stages. Some people describe 4 stages, but others as 5. So I've just picked out from the review just some of the references here. Thomas et al. Study suggested that in the first stage, the microbial cells attach to surfaces reversibly. So this is the point where if you catch the infection early enough before biofilms have been formed, then that infection can be eradicated, hopefully, if the right antibiotic is used. Then they move and to attach to surfaces irreversibly. So they start then to attach, and this is where resistance to infection comes in. Fleming and Wingender's paper discusses that quite well in the review. Then they grow into microcolonies. Borley et al.'s work suggested that this can be tens of hundreds of microns in diameter. So some of the microcolonies are very widespread, really. And then the fourth stage is what happens is they grow into a three-dimensional configuration. This is where the biofilm is actually formed. Cells replicate, and then we have this accumulation of the extracellular polymeric substances. And Alkvist's paper looked at that. The final stage then is where the bacterial cells detach from the biofilm and disperse, and they can actually form new biofilms. Of course, in the tonsils, in the folds, they can get into the folds, and Hall-Stoodley's work looked at that. So here are a couple of slides looking at the different ways, just to give a visual representation of the four stages there in this one. This one looks at the 5 stages. Again, you can see how the free-floating bacteria land on the surface, they aggregate and attach, they start to form the biofilms in stage 3, then they have a mature formation, and then bacteria fly off and actually can go form new colonies elsewhere. So when we look at the treatments then, we can see that they sort of combine the revival of some older techniques, and then some of which use antimicrobials, but also some new treatment modalities. And how this works is the different types of treatment attack and disrupt the biofilms at different stages of formation, as we've seen on the earlier slides, by understanding how that resistance is formed by the EPS. And other newer treatments are looking at the immune response and actually helping prevent biofilms from forming and becoming resistant to antibiotics. So here are some examples of the treatments. These are described much more fully in the paper. Immunoprophylaxis and immunotherapy, and then a host of treatments that look at disrupting the extracellular polysaccharides by topical agents, amino acid, norspermidine, bioactive enzymes, cytotoxic agents, for example citric acid, and then 2 which look at different things, pulsed electromagnetic fields and laser generated shock waves, and in the paper you'll read that this is especially useful for infected wounds, and then antioxidant mediators. Also traditional drugs like non-steroidal anti-inflammatories can actually help to reduce biofilm formation, and then other ways are looking at physical removal, and one study looked at vinegar combined with brushing as being quite effective in certain contexts. So these are described in the paper. So in summary then, recurrent or chronic tonsillitis is a global public health issue. It can severely impair an individual's quality of life. And as we've discussed, these microbial biofilms are a major cause of repeated tonsillitis and other infections. We know more research is needed to develop new treatment strategies, but actually what I think the paper really highlights is that doctors need to be up to date with the research and the treatment of biofilms, not just use different antimicrobials or surgery, but actually thinking about the application of topical agents, physical removal of biofilms and other innovative treatments. I hope you enjoyed the paper. If you want any further information, please contact Professor Manuel Hack, and here's his email. Thank you for listening to the presentation, and I hope you enjoy reading the paper.